Since 1971, the Kansas Hospital Association has recognized individuals who demonstrate distinguished service and outstanding contribution to the field of healthcare in Kansas through the Charles S. Billings Award. We are privileged to recognize Randy Peterson as the 38th recipient of this award.
Always had been very interested in sports and very active. Grew up in a small community, so everybody played every sport. I began in healthcare via a sports injury. When I got to the University of Nebraska, I was playing intramural basketball and injured myself and went to the Student Health Center. And there I met George Sullivan, who is a physical therapist, but he's also the head trainer for the University of Nebraska football team. And George asked what I was going to do. And here I was, first semester, junior year, undeclared. And he suggested perhaps I get into physical therapy. And so that's when my journey began to get into healthcare and eventually got into Wichita State University physical therapy program. Healthcare is such a relationship industry that we really can't be successful if you don't have a great network of colleagues and peers, not only within the organization, but throughout the state, throughout the region, and the country.
Well, I've met many hospital administrators, CEOs in my time in Congress, and they all do a great job of advocating for things they clearly believe in. But Randy is at the top of the list. He's a guy who knows what he's talking about. He has the information, he has the experience, but in addition to that, he has the heart. He loves what he does. He cares about his patients. He cares about the people who work in his hospital. And he just cares about Kansans. And so when he speaks, when he comes to Washington, D.C., or I see him here in Kansas, he speaks with authority and he speaks with credibility because he cares so much and works so hard.
One of the things I'm most proud of is the way we merged two hospitals in Salina. In 1995, which was the third time those two hospitals had tried to merge, we actually got them merged. And so at that time, we came together, one hospital, two campuses, and John Broberg and I were the two senior vice presidents. Clay Edmonds was the CEO.
I enjoyed working with Randy in Salina. Known Randy for over 25 years. And one of the things when we first met, we were actually at competing hospitals. He was at Asbury and I was at St. John's. We were both chief operating officers, but we always had a great friendship.
John and I decided together we need to create a new culture because both organizations had cultures. St. John's had their culture, Asbury had their culture, and we said we need to create a new culture for Salina Regional Health Center. And what we termed that is we're going to have a culture of world-class service, and we're going to create service excellence throughout the organization.
And I think when we worked together on putting that organization, it was really Randy's drive and never losing sight of how important it is to take care of patients.
What probably is so inspirational about him is that he does everything that he does because he cares about people.
Randy was actually the first board chair that I served under as the CEO of the Kansas Hospital Association, and he was such a mentor in so many ways. He helped me get acclimated to that role. He's very diplomatic.
Randy is great with relationships. His very core character is about knowing people, getting where they're at, and understanding them.
While he does his job so well, because he's the kind of person that he is, other people in that hospital do their jobs even that much better.
Randy was so gracious in making sure that he encouraged me in a positive way, and I suspect he does that with everybody, not just those like me who are particularly challenged.
I've toured and visited hospitals with Randy, and one of the things that you detect when you walk around his staff, the people who work there, the doctors, the nurses, and others, they respect him. He inspires them.
In Randy's role at Via Christi Health, he came on board. It was a new position, the Vice President for Regional Operations, which was the perfect fit for him.
Well, at Via Christi Health, I did have the opportunity to serve in interim roles. I was the Senior Vice President of Regional Operations, which meant I had the hospitals outside of Wichita. And we had turnovers in CEOs in Wamego, in Manhattan, and Pittsburgh. And so it was great to really get to interact with the local boards, the local staff.
When the system president and CEO announced his resignation from Via Christi, Randy was called on once again to step in and be the interim leader for the health system.
Randy does such a phenomenal job of getting people together to collaborate on what we need to do to improve healthcare. Randy was very involved in the state initiatives to really make a difference, whether it be expanding Medicaid or really trying to improve patient access.
I arrived Stormont, Vail in June of 2012 and had significant number of meetings with Bob Erickson, who was the CEO at St. Francis at the time. And one of the things we thought we could jointly work on is to improve safety net services for the community. So then we put together a plan where the FQHC would be moved from the Shawnee County Health Department to Grace-Med. The end result should be that the poor and underserved of Topeka and Shawnee County have access to primary care, and that they won't have to go to their emergency department.
I think you can see in Randy a commitment to see the organization live some of the values he holds dear, including respecting others' opinions and valuing people's inputs, knowing that we all play a part in the success of the organization.
I think the way he's able to accomplish so much is that Randy loves people.
I think for Randy, I think his contributions and why he's so deserving of this Billings Award is because of what he's done through collaboration and bringing organizations together to be better at providing great patient care. He's a great mentor and a phenomenal friend, and so deserving of this award.
But it is a real transition from being a caregiver to being an administrator. Your positive feedback and what makes you get up in the morning as an administrator is seeing the organization succeed, seeing the sorts of things that you can do to impact a population of people, not just one person.
Maybe there's a hospital administrator who this is just a job. That's not Randy Peterson. This is his life. He and Christy are about serving other people, and both of them as a team, as a pair, have made a difference in the lives of Kansas.
He's so passionate about family. His wife Christy, his daughters Megan and Leslie, and their families, and the 3 grandchildren he is so excited about.
I know that he was involved early in the provider assessment program to help increase access for Medicaid, and he has been always had a focus for ensuring the sustainability of healthcare in rural Kansas.
When Randy gets involved in something, it can be about healthcare, but it's also more broad than that. It's about the community, it's about our state, it's about doing good.
Randy's got a great compass. Randy's always headed in the right direction, and he seems to understand where the system is going, and he embraces change very quickly.
I look at all the people that have gotten this through the years and the things they've accomplished, and it just really humbles me to think that I'm getting this award. I think I'm in great company.
The Kansas Hospital Association would like to congratulate Randy Peterson, the 38th recipient of the Charles S. Billings Award. Thank you, Randy, for your distinguished service and the unforgettable mark you've left on healthcare in Kansas.